Okay, so we're going to go ahead and get started for this evening. Thank you all three for joining us. We do appreciate it. But this talk is hopefully going to be the first of a series of Zoom talks coming from Mathis. It will probably not be us, but maybe some other students. But to kick it off, we went ahead and started with the most relevant topic we could think of, which is COVID-19 and diabetes. My name is Hadley Wicker. I'm a fourth year professional student from Purdue.
My name is Elise Mann. I am also a fourth year student at Purdue.
And my name is Kelsey Duncan, and I'm a third year professional student at Sullivan.
So I want to give a quick overview of what we're going to talk about today. We're first going to discuss how patients with diabetes specifically are at maybe a higher risk for COVID. We will share some quick tips on how we can protect and prepare ourselves from any sickness really, but especially being cognizant of COVID right now. We will go over how illness affects our blood sugar in general, and then review some monitoring of our blood sugar and ketones during sick days. And once we get done with our presentation portion, we'll open it up to any questions that you all may have.
All right, so we'll start off with what is COVID-19 or coronavirus, which I'm sure all of you know by now and heard it on the news and just in general out, and that's what's kind of stopped the world. But it is a respiratory virus, and it can be spread from person to person through respiratory particles. So essentially your spit, and if you cough or sneeze, anything like that, it can be transmitted that way. Some different symptoms of COVID-19 could be fever, cough, shortness of breath. Those are really the most common ones that you will see. And people with diabetes, and especially uncontrolled diabetes, are at an increased risk for developing severe illnesses in general. And just for this talk's sake, for COVID-19. And I have a little demonstration that may help you kind of understand why that is. So when we have a lot of sugar in our blood, sugar is really sticky, and it's the same when it is in your blood. And if you have a large quantity, it kind of overwhelms your body. So this is naturally how our blood is supposed to flow through our body pretty quickly. And we carry white blood cells, which is these white particles in here. And the white blood cells are what get sent when you are sick to help heal your body. So someone with diabetes, where their sugars are running high, your white blood cells will move more slowly through the body. So you won't be able to heal as quickly from the illnesses, and it makes you more susceptible to getting those illnesses. And then having other conditions like heart disease with your diabetes can also put you at an increased risk for COVID-19.
So many of these things you've probably also heard about 500,000 times, but we did just want to go over these as well, of how to protect yourself and maybe go into some reasons why, so you have a better understanding of that. The first one is to wash your hands often with soap and warm water for at least 20 seconds. I personally like to sing the Purdue Fight song while I wash my hands, but I think you can sing Happy Birthday 2 times through, and that's about 20 seconds as well. So making sure you're doing that regularly throughout the day, and especially when you've been touching some different surfaces. In addition to that, you're going to wash your hands with soap and warm water before and after you check your blood sugar. Again, that's, if you're pricking your finger and then you've got blood, that's going to be a place that you could potentially come into contact with those germs. So making sure you're washing your fingers or your hands. And then you're going to want to make sure you're not touching your eyes, your nose, and your mouth. That is one of the easy ways for the virus to spread, since it's that is your part of your respiratory system, the nose and the mouth. And if it's a respiratory virus, it can get you sick from touching things and then touching your eyes, nose, and mouth. To hopefully prevent some of that, you can clean and disinfect those surfaces that you're touching frequently, just to try and get rid of germs that may be there. you know, we do all have to go to the grocery and eat and maybe even just go out to dinners to keep some sanity. So when you do go out, try to avoid big crowds, but when possible, do just try to stay home. When you're in public, it is important to try and keep a 6-foot distance from others. And the idea behind this is so that since it's a respiratory illness that can be spread when you cough or sneeze or even talk potentially, if you're 6 feet away, there's a whole lot less of a chance of that droplet landing on you and infecting you if you're 6 feet away. So then the idea of wearing a face covering is when you can't keep that 6-foot distance, like me and my friends are here, and that is in order so that those respiratory droplets can't even get out of your mouth or can't get very far when you can't keep a 6-foot distance. And in public places, maybe like at the grocery, you can keep a 6-foot distance most of the time, but that's not always going to be the case. You know, you're at the checkout and there's lots of people around you, or just you could also be putting those particles just onto the surfaces if they aren't being cleaned as frequently maybe as they should be. So that's why it's important to do some of these protective measures.
Absolutely. So what happens if maybe we do get sick, whether that be with COVID or whether that be with any other sickness, really, whether it's a cold, some other virus going on? What is happening to our blood sugar in particular? And the idea to keep in mind here is that when you're fighting an infection, you need to build up this immune response to fight that off. And so your body ends up releasing extra glucose or extra fuel, essentially, to ramp that up and to be able to fight. So whether it could be stress in general, but especially when you're sick, your body is going to release extra sugar in response to that. Some other ways that your blood sugar may fluctuate: if you're feeling sick, you may not be eating your usual meals, especially if it's a stomach bug or something where you're feeling nauseous. You probably don't want to eat, a big dinner or whatever it is. So not eating those same meals or eating much less is going to affect your blood sugar as well. And then finally, if you're not feeling great, you're probably not up for a run or going to the gym or whatever your normal physical fitness schedule is. So it's likely that you won't have the same amount of physical activity, and this can fluctuate how our blood sugar readings are as well. So the big idea here is that there are a lot of fluctuations multiple ways. So, checking those blood sugar readings and just seeing where you're at can be really informative when you're sick.
All right, so now we are going to talk about how to prepare for an illness, and this is just illness in general again. Make sure that you have plenty of blood sugar testing supplies. So make sure you have your meter with you, and then have your lancing device, your lancets, and your test strips, some ketone strips. And if you don't know what that is, we'll talk about that a little bit more. And some fast-acting carbs to treat your low blood sugar. So if your blood sugar falls below 70, that is emergent for you to start treating, because low blood sugars can lead to unconsciousness, and we don't want that. So I have some examples here for you all. So when you're at home, you may have some juice or regular soda, and you're not going to drink like the whole bottle of this apple juice. You would drink about half this bottle. Really 4 ounces is the key of juice or regular soda. And then there's also glucose tabs that you can go out and buy at the store, and this is more portable, so you can have it in your car. Or we also have glucose gel, and you would have to have the whole tube and 4 tabs of the glucose tabs. And those are just some options. And the key there is just simple sugars, because you're going to want to get that blood sugar spiked up as quickly as you can. So after you test and it's below 70, you'll have something that has about 15 carbs. So those examples I just showed. Then you'll want to wait about 15 minutes for all of that sugar to reach your blood. And then you'll check it again. And if it's below 70 still, you'll repeat that. If it's above 70 and you're getting ready to eat soon in the next 1 or 2 hours, you'll be okay. But if your meal is further away than that, you're gonna wanna have something that has carbs and protein also. So I have an example here, peanut butter crackers, but you could also eat apples and peanut butter. You just wanna have some protein in it, so that way it kind of slowly raises your sugar and you don't go up too fast and then go down too fast after that. And then another thing is a glucagon pen. Your doctor may have prescribed this for you, and this is for emergencies. And the idea is that if you can use a glucagon pen on yourself, then it's not emergent enough to use it. That's really reserved for if you're unconscious and somebody else needs to use it. So if you're conscious, go grab your juice and start getting that blood sugar back up. If you have a CGM sensor or a continuous glucose monitor, if you use one of those, make sure you have a sensor to replace it if you're getting ready to be time to replace it. And then plenty of your medications, and talk to your doctor about that also, because those may change when you're sick, but we will also talk about that in a little bit.
So the next thing we're going to talk about is monitoring on those days that you're sick with any sort of illness. One important thing is going to be sure that you're testing your blood sugar every 2 to 4 hours. And the reason behind that is because, as Elise mentioned, illness can do some crazy things to our bodies. So we want to make sure that we're not going too high, but also not going too low, such as Kelsey just mentioned. So testing your blood sugar every 2 to 4 hours is just going to help you keep an eye on it throughout the day, just so you know what's going on, and also making sure that maybe that high or that low isn't going to contribute to making you feel even worse. Another thing is if you test greater than 240 milligrams per deciliter on your meter, if your meter pops up after you test and it says 240, you're going to want to go ahead and test your urine for ketones. You also might want to test your urine for ketones if you do use insulin, or if you're experiencing any unexplained nausea, vomiting, diarrhea, or stomach pain. Those would be good times to test your urine for ketones. And ketones are what happens when your body is having a hard time getting the sugar that's in your blood into the cells that need it. So instead of using sugar like the body normally does, it starts breaking down your fat, and that can cause your body to become very acidic, and an acidic blood is not good for you, as you might imagine. So like I said, you're going to test for ketones using the keto strips, which are available at the pharmacy over the counter. And what you'll do with the keto strips is they come in a bottle, and you'll take one out, and you will either pee on the end of the stick, or you will collect your urine in a cup and dip the stick in that. Either one is fine. But it is important then, after you do that, to check the color of the strip will change, and you'll check that within 15 seconds. And the color will change as seen on this bottle here, and you're gonna compare it to the colors to tell you whether there's ketones, and then if there are, the amount of ketones. So that's how you do the keto strips, the keto strips, and you're going to want to do that every 4 hours if you have any of those indications listed on the slide. And in addition, another thing you're going to want to monitor is your weight changes. Weight loss can be a very good indicator of when you're dehydrated or if you don't have enough water in your body. And dehydration can lead to life-threatening situations, but it can also just make your illness a whole lot worse, and it makes it harder for your body to heal. So it is important to keep a record of your weight.
So you can imagine if you are sick, your medications may be fluctuating. Maybe you got an antibiotic from a doctor, or maybe you're getting some things over the counter. But some other things we want to keep in mind is our maintenance medications as well, the medications that we take every day, whether we're sick or not. So the idea here is keep taking those maintenance medications as directed by your doctor. When our blood sugars are fluctuating or when we're sick, oftentimes you may need extra insulin if you are a person using insulin. especially if that blood sugar is just not coming down because you're trying to fight that sickness. This would also be important if you have a positive ketone test. That insulin is going to be even more important. If you have a fever, that would also be an indication where you might need a little bit more insulin in order to keep battling that. But at the end of the day, calling your doctor or even calling a pharmacist is never a bad idea for getting some medication instructions or some guidance on some tips for that. Some other things to note is that some over-the-counter medicines can end up affecting your blood sugar levels as well. I know some people love to grab an over-the-counter cough syrup. Some people maybe get Mucinex or some pain relievers, things like that. And those syrups, specifically like those cough syrups, can contain sugar that will end up raising our blood sugar. So kind of a rule of thumb is if you can get a medication that comes in tablet form, that's normally going to be a safer bet than that syrup that has maybe some of those extra sugars in it. Also, some decongestants can raise blood sugar as well. So just being mindful of that as you're picking and choosing over the counter. Another thing to note, if you are someone who uses a continuous glucose monitoring system, using Tylenol, or you may hear it called acetaminophen, can cause some false readings in those. Specifically, it can cause some false elevated readings. So this may be a medication that your doctor advises against, or it's just something that you're aware that if you're taking that things may not be as accurate as they used to be. So these are all things to keep in mind with medications that you may be taking during times of sickness.
Okay, so we'll talk about food a little bit, and we kind of touched on this, that when you're sick, especially if you have some vomiting or diarrhea, you may not have much of an appetite, but you still need to eat and drink, hopefully, your usual amount of carbs, because that is our preferred fueling source for our body, and we don't want to go into ketosis, which is what we were talking about with the ketone strips. You don't want to have that acid in your blood because the sugar has nowhere to go. So you will want to try and divide your meals into smaller snacks that you can eat every 2 to 4 hours if you're not having a great appetite. Some soft foods and liquids might be a little easier and will coat your stomach. So some examples are half a cup of Jell-O or pudding, a slice of toast, cup of chicken soup, half a cup of oatmeal, half a banana, and about 6 saltine crackers. And those are the 15 grams of carbs that we were talking about with trying to get your blood sugar up a little bit, because you may be going low at those times, but just making sure that you are still putting fuel into your body so you can fight that illness.
Another very important thing that you're probably pretty aware of when you're sick is that you do need to be drinking lots of fluids. This is pretty much a #1 tip that any pharmacist or doctor would probably give you, is to stay hydrated when you're sick. So one good way to do that is to drink 8 ounces or 1 glass of fluids every hour while you're awake, so that you don't become dehydrated. The best option for staying hydrated is just plain old water. And when you're sick, it might make it a little easier to get down if it's just at room temperature. It doesn't really matter. However you can get it down, drink as much water as you can. In addition, some other good options would be something like a Pedialyte or a sugar-free Kool-Aid. Another would be a Gatorade Zero. And a lot of those things are gonna also have some electrolytes in there that maybe your body is getting rid of through vomiting or diarrhea. So those are good options as well, in addition to water. And then also some diet soft drinks. I know I always really like to drink like a diet Sprite when I'm sick, because the bubbles help my stomach some. But that can be another option. But making sure that that is the diet, so that that isn't spiking your blood glucose way high.
So you can see a lot of what we've talked about today is how we can basically treat ourselves, or how we can protect ourselves and do this all from home. But when does it get to the point where we need to get a doctor involved, or where we may need to give someone a call or even go to an ER? And some things to really keep in mind, specifically for viral infections, with COVID being a viral infection that is all on our minds right now. Some warning signs would be if you're having any kind of trouble with breathing, If you feel persistent pain or pressure in the chest, whether that's kind of in the lung area or chest more like in the heart area, that's definitely going to be a concern. And then also with bluish discolored lips or face, this would kind of indicate to us that we're not getting enough oxygen, that something's not right here. So that would also be a good reason to get a doctor involved. And then specifically, if we are worried about a positive ketone test, which we've talked a little bit about today, some symptoms you might be experiencing with this would be maybe vomiting, some mental confusion even. And then one of the key signs that's really kind of unique to a positive ketone test is having a fruity odor or smell on the breath. So that's kind of a hallmark sign that you might be having high ketones, and that's a serious situation that if you cannot get down on your own with that water like we talked about, we would want to get a doctor involved as well. But at the end of the day, if you ever have a concern that you feel you can't treat confidently on your own, it's never a wrong answer to get some more advice, get a doctor involved. That's always a good option.
So that concludes our presentation portion of the COVID-19 diabetes talk. If you have any questions, feel free to unmute yourself, or you can type in the chat box. We'll be looking at that. But we'll stick around for a few minutes and see if anybody has any questions.
Thank you all for joining us.
Yes, thank you.